Hey, Remar nurses, how are you doing today? I had to come on here. I'm coming on here every day just to speak to you guys, to check in with the community, to see how you guys are doing during this time, and of course to share with you any new developments that's happening in the nursing world, in our nursing community, or regarding Nclex. I'm in a lot of different groups, get a lot of different messages because I have either had so many jobs over the years doing travel nursing or working with certain organizations. So there are some major changes that are happening with the nursing community right now. So I hope not. My number one hope is that you guys are all safe where you are. You're safe, you're taken care of, you have your basic needs, and you're still able to not only provide for your family, but hope for a better future to come along. Like you're able to see that we will get through this hard time together. And on the other side, life will be what we intended to be here in this country. So one of the reasons why I'm coming on is because during this time where we're not meeting and we can't get together, how important is it for us to have, this virtual community? How important is it for you guys to see me, for you guys to see each other and just check in, even if it's just for a second, and say, hey, I'm still studying. We have so many people reaching out to Team Remar, like, what is that? I need to get studying. I need to do something with myself. I'm going crazy in here. What is the virtual trainer? How can I sign up for it? So I have an amazing surprise for you guys in the VT coming this weekend. So everybody that's studying in the virtual trainer, keep yourselves busy and motivated in here, okay? And I love everybody that's coming on here with the hearts on the screen. I so appreciate it. But our virtual community is growing like never before right now, and it just really speaks to how important it is to still be able to stay on progress when things around you are shut down. So one of the major developments in the nursing community right now is I noticed that I've been getting jobs, and I posted one today where people are emailing me jobs and saying, hey, we need nurses in these different states, and they're paying like $80, $90, $100, over $100 an hour for nurses. And I have never seen these type of rates before. So I'm sharing with you guys all of these job postings that I'm getting because I want you guys to see that this is a very, very very valuable task that you guys are trying to achieve and trying to go after. What you're doing right now, it does take a lot of sacrifice, but when you get that nursing license, literally you can write your own check. You can write your own check. And even me, myself, I'm looking at these jobs like, man, if I wasn't, right now I can't go out. I'm just like, I have to be careful where I go and all these things like that. But yes, it's like if I weren't the number one Nclex instructor on the planet and I didn't have a platform and a community to support, I could be out here. But since I'm not, I want to share it. I want to share it with you guys just to encourage you guys and motivate you guys that it's possible. All right. So yes, I can sing you. I can check to see. I know a lot of people ask me the job that I posted. Are they hiring new graduate nurses? Are they hiring LPNs? So let me check with them and clear that road for you guys. And then I can post that link. Yeah, I can absolutely do that because $80 an hour, $90 an hour, that's really amazing if you're able to help at this time. So, I promise you guys, I will help you to pass that Nclex. And that's why I'm so thankful for the virtual trainer because all the new things that I'm working on right now are going into the virtual trainer. So tell your friends about it. Tell yourself about it as well so that you don't get discouraged. Another thing is just an update on terms of Remar. We do have half of the team working from home. Our shipping is still going out daily. So those of you who purchased today, we had I can't even remember. Yesterday, I think we had 40 or 50 students, maybe more than that, join the virtual trainer. So all of your guys' products will be going out today. So you will be getting them on time. That's why I'm encouraging you guys. If you haven't gotten your virtual trainer workbook yet, you need to order it, because as of now, we're still able to ship. However, my mom was telling me that they brought in the National Guard to work the food banks and stuff in Ohio, in my community here, and they are just really saying that they're about to shut the city down. So don't wait. Okay, so everything that I'm adding to the virtual trainer will be for RNs and for PNs. Now, what else do I want to talk to you guys about? Oh, new development with the Nclex. Which is, and this is a disclaimer, okay? This is the disclaimer. The changes that I'm talking about for the Nclex, I do not expect to see for 3 years, okay? So these changes, the one that was released definitely will not be on your Nclex, okay? It will not be on your Nclex unless you wait years and years, okay? So I'm just going to tell you guys that you all know that they have been looking to make changes towards the Nclex. They found that it's not really a great gauge on clinical judgment. So NCBSN came up with this huge new clinical judgment model that they now want you guys to follow, and that's how they're basing all their questions off of. And also, for the virtual trainer, if you want the virtual trainer, remarnurse.com. Just go to remarnurse.com for the virtual trainer, for those of you who want to get it. Okay. So they've been doing all this research about how they're going to change the next generation Nclex, what it will look like, what the presentation will look like. And it's been a big mystery. When I was at the conference, the Nclex conference, not this year, but last year, they alluded to some things that they would be doing. Well, yesterday, they made an official report saying that one of the definite changes to the Nclex, not for 3 years, remember guys, not for 3 years, one of the definite changes will be that they will for sure, absolutely be adding case studies to the Nclex, right? Case studies. Now we already knew that case studies were more than likely going to be on this new Nclex. Already knew, and I'm going to show you an example of the ones that they have here of a case study. But so they said they're going to have these case studies on the exam, and I already told you guys that they were going to include case studies because case studies used to be on the original Nclex. If you look at the Nclex from the 70s or the 80s, if you read those documents, if you read that research, you see case studies on there. So they're really just returning to what they used to do. Case studies are perfect because they allow a nurse to demonstrate multiple areas of one topic pretty well. So instead of the Nclex giving you one question here about cancer and one question here about pediatrics, like randomly testing you, no, they're going to focus you in on a large disease process. It may be diabetes mellitus type 2. All right. And they are going to have you follow a patient from the time the patient enters into whatever clinical situation it is, whether it's the emergency room or, a community clinic, and literally have you walk through that patient's care, picking things that are abnormal, medications that could be prescribed, diagnostic procedures associated with it. And so it's very cool. It is very cool to anticipate this type of presentation because it's really easy to prepare for. So I was looking at the example that they gave, and I'm going to show you guys. And I said to myself, you guys are not slick. The NCPS saying you guys are not slick, okay? These case studies, although they have a lot of medical jargon in them, and they're written very well, the Remar community, the Remar nurses will be able to do this, okay? They will be able to do this, no issues. I have no problems that you guys will be able to do this case study. So without further ado, we're going to mosey on to my laptop, and we're going to look at this case study example that we have here. Now, remember, when you have a case study, the very first thing that you see is a background of your patient. So you get a huge bulk of information about one patient that you have to break down and digest, and then you're able to move through their care. Now, this will not be for years. This will not be for years, okay? 3 years. So don't worry about it, okay? Don't worry about it. However, if you're in the virtual trainer, guess what you're going to start seeing? You're going to start seeing case studies just like this, okay? So I wrote one today. Actually, Mark and I we had to leave this. We had to go to the next city. And while we were in the car, I wrote a case study, put it in the virtual trainer, so you guys will see it this weekend. Okay, so here we go. Here is and I just got this on my computer. You guys can see it here too. Hold on one second. How can I? Let me straighten it up for you guys. All right, let me see if I can make it. Can you guys see that? Is that clear to you guys? If I do it like that, let me know if you guys can see it. Or if it's backwards. Is it backwards to you guys, or can you see it the right way? Let me know. All right. So, essentially this is a background of a patient here. And it says here, the client was brought to the ED by her daughter, okay? The client was brought to the ED by her daughter due to shortness of breath this morning. Now, remember, you guys are supposed to be catching things here, all right? The daughter reports that the client has been running a fever for the past few days and has started to cough up greenish colored mucus and to complain of soreness throughout her body. The client was recently hospitalized for issues with atrial fibrillation 6 days ago. The client has a history of hypertension. The vital signs were 101.1 degree temperature, pulse 92, respirations 22, and systolic pressure 152/86. Pulse oximetry reading 94% on oxygen, okay, at 2 liters via nasal cannula. So upon assessment, the client's breathing appears slightly labored, and coarse crackles are noted in the bilateral lung basis. Skin slightly cool to touch and pale pink in tone, +3 pulses, irregular. Capillary refill is 3 seconds. Client is alert and oriented to person, place, and time. The client's daughter states, sometimes it seems like my mother is confused. Okay, so essentially here what Nclex is going to do is they're going to give you information about a client based on a nurse's assessment. So you have the thing about this is you have all of the correct information here. It is a matter of, can you identify what is important throughout this whole story of the patient? Okay. And the way that they will do that, they say this. Okay, so we all have the history here. We know what kind of patient we have. We kind of know what's going on. So a question that would determine whether you know what is actually happening here is this. It would be like this. All right. Drag the top 4 client findings that will require follow-up to the box to the right. Okay, so this is a drag and drop. But look what they do. They actually give you the client findings that would require follow-up. Okay, so what they're asking, they're saying from that case study there were some things that were irregular. There were some things that were abnormal, such as the vital signs. Okay, do you guys remember the vital signs? Do you guys remember what was abnormal with the vital signs? Okay, because we can look at it again here. Look at the vital signs. Temperature 101.1, pulse 92, respirations 22, systolic pressure 152/86. So this will require, looking at this vital signs, this will require, you got to know your basic vitals, right? Easy. We know that. Okay, so they're also saying, based off of the scenario, while I was reading it, did you guys realize that the lung sounds were kind of off, right? Do you remember the lung sounds? Do you remember what it said? All right. What did it say about the lung sounds? It said that what? What did the nurse hear? The nurse heard, okay, so the client's breathing appears what? Slightly labored. Coarse crackles. All right. Hey, what is that? That's an indication of something. What is that? All right. In bilateral lung bases. Okay. All right. Capillary refill. They're saying, hey, capillary refill. That might have been a little off. All right. What's going on with that? You guys remember what the capillary refill is? What information do we have about that? It says that the client's skin slightly cool to touch, pale and pink in tone, +3 pulse, and irregular capillary refills 3 seconds. Okay, so we're talking about case studies here that won't appear until in 3 years. Okay, but what they're doing is they're trying to get people like myself ready to educate you guys on things like this. All right. Case studies will probably start for RNs, but I wouldn't expect the PNs to be too far behind. All right. Client orientation. Are we worried about the client orientation at all? What does it say about it? It says the client is alert and oriented to person, place, and time. All right. Is that good? Person, place, and time. Are you guys okay with that? All right. What about the radial pulse characteristics? The radial pulse characteristics. Okay. What did it say? Hey, the pulse there. Pulse was 92. But look at this. Recent hospitalization for issues with atrial fibrillation 6 days ago. So what they're asking here is, and then the last one before I go, characteristics of a cough. Oh, yeah, the client had a cough. She did have a cough. What was up with the cough? Do you guys remember what it was? Because you have to remember all these things. So if we look back, we see that, the daughter reports that the client has been running a fever for the past few days and has started to cough up greenish colored mucus. Okay. All right. So all of these are little details, and they're saying of the 1, 2, 3, 4, 5, 6 of the 1, 2, 3, 4, 5, 6 client findings here, go ahead and give us the top 4. And so that would be a new question on your Nclex. Okay. Now, do you guys think you could do it? Do you guys think that you would be able to do it? The top 4. Okay. The top 4. I'm just asking because when I look at this question, I see people putting it up there. And the thing about it is, they didn't give us their correct answers here. Okay. They're just trying to show educators that, this is how we're going to present the material to the patient. I mean, to the students now. All right. Now, when you look at this, most people would think, oh my goodness, this is a whole new question. I have never seen anything like this before. I don't know. I've never seen anything like this before. But actually, this ain't nothing but a select all that apply. That's all this is. It's just written differently, right? Normally right now, this would say which of the following, is the priority? that requires follow-up assessment. That's all it is. So I'm like, all right, you guys, I see y'all. I see it. But you know what? If you aren't familiar with the basics of these topics, it's going to be, this is going to be unusually difficult for you. It's going to be unusually difficult. So, I mean, we always got to go back to the content here, because honestly, all this is a story. Okay, this is a story for nurses. And some people are saying, oh yeah, this is how school taught us. Yeah, a lot of nursing programs do case studies all the time. And so we just weren't used to seeing them on our state board exams. But in fact, they are quite common. And so when I saw this new change, I was excited, to be honest, because I think that this will give students who may deal with anxiety, honestly, this may give them a more comfortable feeling to the exam. I think sometimes you have to warm up to stuff. And so a case study will essentially allow you to stay with one patient and warm up to that diagnosis. So, you know, there are many things I think that we could be fearful of. And again, this change, this might be better than select all that apply. I like that. You know, and again, this change won't happen for years, because there's a lot of things they have to do. Like, they're just showing us what the questions could look like, but they still have to test them. You know, they still have to make sure that it is exactly, appropriate and not biased, and, well received by the board members and things like that. So I just wanted to jump on here and show you guys that this is the first thing that they have definitely said, everything has always been kind of like, well, we think we're going to do this, or you might have a potential to see these type of questions. But the case studies is the first thing that I've read that says, yes, we will definitely be adding case studies. And so it was a surprise, but not a surprise, but I wanted to share it with you guys, just so you're in the know. You're in the know. And also, for those of you who hate case studies, who don't want to do case studies, y'all hurry up and get y'all license, because you won't have to see this. But if you wait 3 years, you will be seeing this. You will be having this conversation with me. Nurse Mercy says, this is what we do in the UK. Perfect, right? Is this for RN and LPN? They're testing this for the RN exam. So they're testing this for the RN exam, and I do believe the PN follows the RN not too far away. So if they feel like this is working, then this is going to be for all of the exams across the board. And so they didn't give any answers to what, what they thought. They basically were just saying that case studies are a great way to follow the new clinical judgment model. All right, the new clinical judgment model here. So I was just really excited to share it with you guys today. I didn't know what I was going to talk to you about. I always want to have something to bring to you guys, and I thought this would be great. And I just want to show you this clinical judgment model here, the steps of it. I was able to pull it up. I didn't think I could. But so the clinical judgment model, I say it, but if you've never seen it before, I did do a presentation on it. Shout out to the nurses in Haiti. Lynn says, this is what we do in Haiti. Yes. And I love the international community, because now everybody's like, okay, we do this in Cameroon too. Nurse Agnes. Okay. All right, so you guys are prepped for this. Okay, so the clinical judgment model essentially, they're moving from what used to be essentially what, right? Remember, Nclex is all about client needs right now, and clinical decisions based on client needs. But they're saying, that's layer 0. Like, that's just not good enough to get to this clinical judgment, and it leaves out these steps like forming a hypothesis, refining the hypotheses, and evaluation. So they have added what they call this clinical judgment model here that takes students through these steps. The first step is recognizing cues. Then can you analyze the clues? So recognizing cues would be like what we just read. Like if you are presented with vital signs, can you pick out one that's not right? Can you pick out the weird one, right? Can you pick out the abnormal one? And then if you can do that, what does it mean? Okay. All right. So you can think, okay, all right, that's not a right one. Like that's weird. That doesn't look right. So then you can make a hypothesis. Why? Why was that temperature off? What could it be? Is it an infection? Is it a urinary tract infection? It's a fever. So is it strep throat? Is it the flu? What could it be? And you can generate solutions. Okay, if my patient has a fever, what are some things I can do as the nurse? Can I remove some clothing? Can I notify the physician? Request some acetaminophen? All right. What can I do? Then based off of what the healthcare provider prescribes and what you think, right, is correct, is it safe, you can take action, and then you can evaluate the outcomes. So, this is the new clinical judgment model. And so the questions will be really focused on these principal activities: recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking actions, evaluating outcomes. So, I mean, good stuff. I mean, like really, really good stuff, guys. And it will honestly allow us to get back to, it will allow us to really to get back to the content and get back to the fundamentals. And so if you are used to seeing these kind of questions, if you're used to breaking down cues and analyzing, what you guys are doing, you're already doing that. Okay. Yes, we already been doing that. So this will just be the transition into that. And this is where you need content, because if you read through that case study, there is no room for strategies. There is no room for any type of strategies there. It's not going to be like, oh, hack the case study. No, I see people offering that kind of stuff all the time. You are not going to be able to hack a case study. Okay. It's just going to be what you know. All right. So if you when and if you guys do take Nclex, especially you guys who have scheduled into May now or the end of April, after your exam is over, you will have the option to be part of the study, and you will have the option to essentially do one of these case studies for practice. It won't count for anything, but you can do it. You can do it to give them information whether this is good or not. All right. And if you have the virtual trainer, like I said, if you have the virtual trainer, I wrote a case study very similar to this, and I put it in the before the books arrive section. So I will be releasing that Saturday. There's a couple things that I want to add to it. I thought of 2 more questions I want to add to it. So it will be a 6 question case study based on the same patient. And I just want to see how you guys do with it. I hope I don't scare anybody, but I just wanted to challenge you all. So virtual trainer, I am working so hard. The whole team is working so hard that you guys can stay busy during this time, because now you have this waiting period, and I don't want you just sitting home not doing anything. I want you to actually be engaged. And we're still doing the flash sale. So the virtual trainer price down, we brought it down to $149, and if you have the 5-star quick facts, that is just $129 now. So great time. It's a great time to be in the VT. It's a great time to be in the VT. So I just want you to be encouraged, because another thing that I didn't tell you guys is that right now the need for nursing is so vast. why they don't have us taking our tests now, even if it was just 4 or 5. My dad asked me, he said, Regina, why don't they just let 4 or 5 of you take the test at a time? And then that's just it. I said, Daddy, I don't know. They don't want anybody taking the test. But anyways, I had got this email from, a job that said Texas, the Nursing Board of Texas no longer cares where you're licensed. If you want to come work in Texas and you have a license in Ohio, Hawaii, Guam, wherever we have a territory, you can come and work there. And I thought, oh my goodness, that is so crazy. Like, you guys know the process to get a license. You know, if I have an Ohio license, if I wanted to work in Texas before, I have to fill out an application. I'd have to do, Texas used to have to make you do this child abuse class. I believe you have to learn their specific state things. Now they're like, it is so bad. We need nurses so bad that as long as you have a valid license anywhere, you could work. You can work. So that's just the climate that we're in right now, guys. I don't even think, I know we talk about compact license, and if you get a license in one state, you can maybe work in the next state over. But things may change so much here that once you get licensed, it is a universal license in the entire, United States and all of our territories. How crazy would that be? How awesome would that be that if once you got your license, you could go anywhere? You could go anywhere. So, nursing. In the midst of all of this chaos, it is the best profession to have as far as opportunities. So they haven't said anything about foreign license. I don't. And I've been looking because I know a lot of my nurses are international nurses. They have not said, but hey, listen, we don't know what tomorrow holds. Literally, we are taking it. I've never taken it day by day like this. Seriously, especially when it comes to Nclex and nursing, because the content usually doesn't change. But the climate that we're in right now, I'm literally taking it day by day. Am I the only one? Like when I wake up in the morning, I look at the news and I say, what changed overnight? What changed overnight? So I am, I'm just excited for you guys. I'm so excited for all of the new nurses. Okay, so Carrie Ann, I got my VT today. Yes. Get in there. Get started. Regina, please, how do I have a VT? You can have your very own VT, your own virtual trainer. Go to remarnurse.com, okay? remarnurse.com and sign up for the virtual trainer. Once you go to remarnurse.com, all the doors will open up for you then, all right? You said you can even go to Africa and work. Nursing is the best. Really, Eleanor, you can go to Africa? All right. So I don't know about foreign licensure yet, but anybody that's a foreign nurse, you guys know that it is a process to get a U.S. license before even taking the Nclex. All right, before even taking the Nclex, because you have to take an English proficiency test. That can literally, the application for that, just to take the test, can take months, years even. All right. And now it's a possibility where, all of that could be cut short. Cut that CGFNS short. That process might take too long. How can we make it more effective? How can we make it more effective? There's just so many possibilities right now. I just don't know. Does the 5-star Quick Facts book come with the CD? It does not automatically come with the CD. And to be honest with you, I don't know. Email support at Remar Review to ask about it, because I don't know the capacity that we have in order to ship out those DVDs or not. I have Quick Facts. How does that work with the virtual trainer? That's a great question. Where's my Quick Facts book? I don't have it. But when you get the virtual trainer, if you already have the 5-star quick facts, you will notice that it has great information in it. Quick facts has great information. When you get the virtual trainer, you will see that the virtual trainer has all the information the quick facts does not have. So I wrote them together. Quick facts was never meant to be an Nclex review by itself. It never was. It was always to be used in combination with my lecture workbook. So when you get the virtual trainer, in the file vault of the virtual trainer, you'll have your calendar there, and you can see how you can study the quick facts and the student workbook together because they're meant to be studied together. Okay. And then someone says this. Okay. So yeah. So I will add I'll add one document. I wrote another book for you guys, and I'm adding it to the file vault this weekend. And so this book, I'm just making it an ebook so you guys can download it and you can study it. But I felt like I wanted to support you guys more in a specific area of the virtual trainer, and I was like, I want to give them something to do. So I'm basically telling you, I wrote you guys a book, so you'll have to be able to print it out, or you can study it from your computer because you'll be able to download it. And then I'm also putting a case study into the virtual trainer. The before the books arrive section, you'll see a case study in there, and then you'll see several other quizzes in the before the books arrive section. And I'm putting everything in the before the books arrive section because if I put it in the virtual trainer lecture house, it will mess up your progress. So I'm just putting it in the before the books arrive section because honestly, it is something that you guys can do in your spare time. It's something you can do optional. I think the before the books arrive section is phenomenal. I think it is a great way for you to stay engaged. I think the questions in there, some of them are quite difficult, quite challenging. And I know that some students skip it and they don't go into that section at all, but it's your virtual trainer, so it's whatever you want to do. And yes, I'll put it in the VT. The VT is for both PN and RN. There's a practical nurse virtual trainer, and then there's a registered nurse virtual trainer. So I am putting the new things in both. So even if you are a practical nurse, try to do the case study. It may be, it may take you a couple times to pass the test, but it's based off of a topic that's so general that I expect you to know it anyways, all right? I expect you to know it anyways, all right? So, again, it's great. It is great. We are still in a great position. We have this amazing benefit of having the virtual trainer where we can study together. We can update each other constantly. Nobody else is doing this. So I'm so glad that you guys found Remar Review, and every day we can have these conversations and just check in with each other. Check in with each other. How important is that? When we can't physically be together, to be able to gather together virtually. And every time I come on here, I see that you guys, you're right here with me. You're right here with me, just getting through our days, trying to stay positive, still loving nursing, not discouraged, still keep moving. And this is the year. I mean, who would have thought 2020, if you would have told me in January, New Year's Day, that in a few months, I would not really want to leave my house, or that we would have totally had to, stock up on water because there's a virus that's coming. I honestly would have struggled to believe, you guys. I go into my store, there's no bread at all. I go into my store, there's no bread, okay? I mean, literally, I'm like telling Mark, go get yeast, go get flour so I can make bread. Like, who thought that I would have to, it's just, I don't know about you guys. For me, it is, it's something to really, 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 it's something to really, just be like, God, what is going on? You know, what are you positioning us for? What mindset are you requiring us to have during this time? You know, and it's very interesting because when you don't have access to the luxuries, right? When you can't go to the movie theaters, my kids were like, Mommy, can we go to the play yard? They like to go to the mall and the play yard. You know, I'm like, I can't take you to the play yard right now. You know, we can't go there. You know, so trying to explain to a 3-year-old how the play yard is closed because he might get sick. It's just like, man, you know, what mindset do we have to have right now? So and I say all that to say that when you don't have distractions or things that take away your attention, you really can focus on what's important. And what I found in my life, that what's important for me right now is God, because if I didn't have God for myself, I would be like totally insecure about what's going on, but I already know what's happening. My family, totally important to me. You know, Team Remar, thinking about them all the time, wanting them to stay safe, wanting them to stay healthy, you know, wanting us to still be able to do what we love to do. You know, and you guys wanting to check in with you guys and just see that you're okay. And, you know, hear you guys say, yes, we're still studying. You know, I love this community. Like, this is what's important to me. And I have never, I don't think I've never been more appreciative of the platform that we've built here. I don't think I've ever been more grateful to have you guys as a part of my life, Mark's life, Team Remar's life. I have never been in this situation where literally it's like I appreciate being able to say hello to you guys. I appreciate being able to share with you the emails that I get, or, you know, what I saw on TV, or, you know, what somebody sent me about nursing. And so, yes, I know. And everybody that's a parent, you kind of feel that way, you know, trying to explain this to your children, no matter what age they are. The teenagers, I can't even imagine if I had a teenager right now. Shout out to all the moms with teenagers, trying to get them to understand that, no, you can't hang out at your friend's house. I don't want you to go over there, you know? So we're all in it together, no matter what age our kids are. And then, you know, having to still study, having to still come on here and study, and then having to be able to go home, well, not, you're already home. You're like me, you're already home. Having to be home and cook meals and things like that. But I'm just really happy, okay? I am. I'm just really happy to be able to educate still from here. Because I know like I said, there are many teachers right now, nurse educators, who cannot see their students. And they don't know what their students are studying, and they have no way, you know, to really get on their students. Like, you guys got to still continue to study. So definitely. All right. So I have a few minutes. I just want to take questions. If you have any questions about this book here. And again, this weekend, you guys should be hitting this book hard. Okay. Hitting this book hard, because you're home. What else are you doing? We're home. We're studying. And we're trying to get this information in our minds, right? So Keela says, I have a 2-year-old, a 16-year-old, and a 13-year-old. Oh my goodness. Mind blown. So you're with me there. All right. Eleanor says, I'm at work right now studying with Quick Facts and VT closer to me. Awesome. Studying at work. Nurse Ashley says, it's not cool at all with teenagers. We're just trying to make them understand the danger out here. Yes, with the general public. And I know, and the kids at home, they're eating up everything. My daughter was like, can I have the fudge stripe cookies? No, you cannot have the fudge stripe cookies are not for today. Like, you know what I mean? So I'm trying to, they see the food, they see the snacks, you know, because they're home and they're constantly eating. And I'm trying to tell them, these are rations. All right. All right. And homeschooling is no joke. Look, my classroom is behind me. I started homeschooling in September, so I'm down with it, actually. I already been doing it. And you have a 7-year-old, a 15-year-old, and a 17-year-old. Oh, my goodness. All right. Hi, Regina. I'm planning on the VT. I plan to get the VT on Monday. Does VT have practice tests after lectures? Yes. Virtual trainer. In your workbook, after your lectures, you will literally see things like this, which says basic care and comfort homework exam. So you'll have exams, practice exams, and progress exams. All right. Do I plan on selling the self-study DVDs soon? No. There will be no more DVDs sold from Remar Review. So I'm just taking questions right now, interacting with you guys. So yes, there will be no more DVDs sold at Remar. We no longer sell the DVD program. I have updated it. I have expanded on it. So it's a great program, but I no longer need to sell it because I have a newer product that's out here that is superior to that program. Okay. I don't have a test date. When should I get the VT so it lasts around my test date? Well, I would say right now we're doing the flash sale for the virtual trainer. So when you get it right now, and well, what I'll say this is you get 90 days access to the virtual trainer. So you get a whole entire 3 months to be with the program. And as I'm adding more stuff to it, you will have plenty to do. I think you will have plenty to do. And you can always renew it as well if you want to extend your subscription. My only concern right now is that I don't know what other kind of restrictions they're going to do in terms of shutting down states. What I see right now is some states are shut down. So like California, non-essential businesses are shut down. Remar Review, although we help nurses get their license, we would be considered a non-essential business. So that means that we would not be allowed to be open during a shutdown. They don't have this type of shutdown in Ohio right now. Our neighbors in Pennsylvania have it, but we don't have it. So, what I'm saying is that if you want to get the virtual trainer, please get it, because now I can send out books to you. We have our shipping department still open. We're able to mail you guys this book. This book is so, I know it just seems like a book, but it is so important to your experience in the virtual trainer. And when you don't have it, trying to take notes and study those videos will become very difficult. Okay, so yes, now Illinois is shutting down. Yeah. So I honestly see a national shutdown. I don't know when that would happen. I just don't know. And so we're having the flash sale now because, you know, we can get these products to you. Okay. And we do international shipping at this time too. We do international shipping. I have the virtual book and I'm enjoying it very much. Right now I'm about to study. Awesome. How do we get it? How do you get the virtual trainer? RemarNurse.com. RemarNurse.com. Also email support@remarreview.com. And Team Remar is waiting to help you guys. All right. Whatever you need, Team Remar. If you have a shutdown, are we able to access the virtual trainer? Absolutely. Because the website online will still be normal. So if you can get online, you can get the virtual trainer. If you can get on your phone, you can get the virtual trainer. Whether they shut down the Remar office, as long as I have a phone signal, you guys will have me. All right. And you will always have your virtual trainer. That will be yours. Once you purchase it, you're in there. It's your subscription. We just won't be able to probably ship out any more virtual trainer workbooks, quick facts, all those things. So right now, this is gold. All right. For you guys who are studying. All right. And of course, right now we're doing free shipping with the flash sale. So come on, guys. I always forget that part, but that is so integral. You know how you love free shipping, and we're doing it right now. All right. Somebody says, I'm going through my VT for the second time. Awesome. And right. So you get 90 days in the virtual trainer. So you can literally go through the program. Whether you want to follow the calendar or not, you get to go through it again. And like I said, I'll be adding some cool stuff to it this weekend. Definitely when I see you guys on Monday, I'm going to be grilling you. Like, did you get that book? In the file vault, did you take the exam? Tell me, how was it? All right. So Anything else about the virtual trainer? It is Friday. I am preparing for my Sabbath. What I would love to do, and I don't know if Mark is watching this. He was watching it earlier, but I would love for us to come back on here maybe tonight or even tomorrow and just do like a devotional with you guys and just look at some scriptures and just have a good old study prayer session, because I think I need that this weekend for sure. So we're here. We're in the house. We are studying. Oh, Mark Callion is on watching. Shout out to Mark Callion. You're always there, honey. I love you. All right. Yep. It is still such a wonderful opportunity to see you guys here. And we are going to get back to the grind by studying all the material, all that content that we need to know to pass this Nclex. We can do it. All right. I'll be adding this stuff. It'll be after sunset on Saturday. So, what time does the sun set in Ohio? I don't know. I have to look and see. All right. All right. So, as long as what I'll say is this, as long as you have the virtual trainer, you will have access to your Nclex study material. All right. And get in there, make it your own, dominate it. Don't be intimidated by the virtual trainer. Understand that it is there in place to be your study partner. When you can't find anybody to study with you, consider that virtual trainer as your study partner. So don't be angry at your study partner when it doesn't let you just do what you want to do. All right. Take your time with it. Take your time with your study partner, and you guys will work through it together. It's so good when I see 75% complete, or I look at a student's account and I see 64% complete. That's a really great feeling, because I know that you guys are pushing through it and you're working. Don't sleep on the before the books arrive activities. Don't, because those practice questions in there are very good. Okay. So yes, happy Sabbath, guys. Have a blessed, restful weekend. It's been a long week. But we are doing what we love to do, which is nursing. We're preparing. We're at the transitional stage where we're trying to break into the career, break into the field. But I'm telling you guys, it is an amazing world of opportunities once you get your nursing license. So we're just waiting on you to do that. All right. So have a great, I can hear your voice when I'm sleeping. So funny. That is. And that's not the first time that I've heard that. I am not, new to hearing people say that. And I can't listen. I know I put out a lot of videos. I know I do. So if you go to the YouTube channel, if you're watching on Facebook, you literally can spend 20 hours just listening to the content that I put out. That's what I'm saying. Remar Review, #1 Nclex instructor on the planet. So happy to be here with you. Coronavirus, whatever it is, we're holding it down, okay? We are holding it down. Shout out to Team Remar, working so hard. You guys are fantastic. I cannot thank you enough. I appreciate you so much. And of course, our Remar nurses, the community, the comments. I go back and I read the comments on the videos and I just laugh because you guys have the best comments, So any questions that you have, email support@remarreview.com and we'll make sure that you are taken care of, because that's what we're in the business of doing around here. So thank you so much to all my international nurses who are watching. I don't know what the climate is as much for you guys if you're in, Africa or Canada or the Philippines. So we're just praying for you. Stay safe out there. All of my American nurses, we have to, during this time, support each other. If you have elderly family members or loved ones, give them a call, look out for them, keep them out of these stores as much as possible. Okay. And let's just love one another. This is an opportunity for us to be kind and good to each other, and for nurses to shine their lights so bright, because we are already in the habit of taking care of people. So this is what we do. All right. So until later on, I will see you guys later. Don't forget, Saudi Arabia. Yes, absolutely. Praying for you guys as well. So don't forget, we are studying. It is the flash sale. I just saw somebody, if you already have the quick facts. All right. If you already have the quick facts, the virtual trainer price drops from $149 to $129. All right. God bless everybody. God bless everybody. I am out of here. And again, praying for everyone's safety until we meet again. I love you guys so much. Take care. Bye-bye.